Is it working?
Come out over there.
Is it working? Is it working?
Oh, I think we turned it down when we were testing your video.
Are you? Do you guys hear me? No. Do you guys? 1, 2, 3. One, two, three. 1, 2, 3. 1, 1. One, two, three. One, two, three. 1, 2, 3. 1, 1. 1, 2, 3.
How's that sound?
1, 2, 3. Okay. Hello, everyone. Thank you for coming. Today we are going to talk about stress. How many of you feel fatigued and exhausted? Raise your hand. From every 10 patients I'm asking, usually this is one of my questions when I'm asking them. 9 of them, they are saying none. When I'm asking level of energy, they answer none. One of them is related to stress and adrenal fatigue. I'm going to explain that. Some of you guys maybe are new, nothing to disclose. We are talking about how we can prevent dementia. Can we? The answer is yes. Can we delay? Can we prevent? Or even can we reverse? The short answer is yes, and that's why we are here. Today we are going to talk about stress, and next month we are going to talk about social connection and isolation. Social connection and isolation itself is a stress. But I decided to talk separately because it's really important, especially for older adults. We have 3 systems: simple, complicated, complex. Simple, like making soups, is simple ingredient. We are mixing per recipe, and whatever we have is a soup. Complicated, like cars. They have many components, many compartments. Engineers, they're calculating, assembling, optimizing, making quality control, and the final product is complicated car. On the other hand, transportation is complex. Not only depends on cars, depends on driver, road, weather. Raising child is complex. Because we think we're perfectly doing everything right, 10 years, 15 years, 20 years, suddenly we see something goes really wrong. Medical health, biology, and brain health also is complex. That's why I'm talking in different way. Just I wanted to mention everything is related to each other. If I have less stress affecting my sleep better, when I'm sleeping better, my inflammation is better. And when my inflammation goes down, my memory gets better. It's a network, everything connected. That's why they are calling continuum of healthcare. We have disease or dis-ease one side, and we have ease or wellness another side. We can go either way. The most important part and most dangerous part is middle one, comfort zone, asymptomatic. My nurse had no problem. In the clinic, she fell. She was dizzy and she fell. They took her to Behrendorf. She had massive clot in her lung, and she had clot in her legs. So not having any symptoms doesn't mean you are healthy. This comfort zone or asymptomatic is very important. We can be comfortable. We think nothing is wrong, but you still have power to push to the wellness and optimal health. Either way we can go. And if you have disease, if you have high blood pressure or cholesterol or diabetes, you are not victim of it. You can reverse it. You can reverse your blood pressure, and you can be completely medication-free. This is your choice. The core of brain and memory health is emotional outlook. The core is all matter of how we feel. If I'm stressed, I cannot sleep. Last month we talked about that. If I'm stressed, I don't have enough energy to go to YMCA and exercise. Emotional outlook is the core of our program. If you want to be healthy, you want to be sharp, and staying at home, this is the core. You have to work on that. That's number one. These two books I'm recommending. Before I start about stress, we have to avoid to be busy. We have to decluttering. In this country, there is too much of everything. If I go to Hy-Vee, I wanted to buy simple water. There is too many options, making me decision fatigue. In every aspect of our social life, there is too many things we are looking for, and society teaching us we can't have it all, we can't do it all. We can't. I was hospice and palliative care director for 10 years. Sometimes people end of their life, last few days, we were talking. Some of them, they were regretting the way they lived. They were paying attention to some stuff really was not important. And they were paying not paying attention to very important things. We have to make it decluttering and make it simple, and whatever is left, we manage better. We have this busyness in a school, at work, even healthcare. There are too many meetings, too many emails, none of them make sense. And we are too busy, and unfortunately, society is saying if I'm busy more, it's kind of more important. No. From today, I think we have to find some way to live simple. We are buying too many stuff we don't need with money that we don't have to impress some people really we don't even like them.